Around 150 million world citizens have asthma, and the number is expected to increase 180,000 a year. In Indonesia, the exact figures of asthma patients not yet known, but according to medical data, the number of patients is increasing every year. In response to this situation, the government has cooperated with the Indonesian Asthma Foundation, and I'll be speaking right now with the co-chairman of the Indonesian Asthma Foundation, Dr. Faisal Yunus. Hello, doctor.
Hello.
How are you?
Fine, thank you.
Yes, as the number of asthma patients in Indonesia is increasing annually.
Yeah, that's right.
And can you explain why?
Many factors contribute in this issue. First, because of the increase of smoking in the population and also increase in air pollution. As you know, so many vehicles, so many industrial, and then also the change of lifestyle. Yep. That's the factors make the asthma increase, not only in Indonesia, but also all over the world.
Oh, I see. In general, how many asthma patients are there in Indonesia right
yes,
now?
Yes, actually we don't have the national data, but from institution to institution we got that in the rural area it's about 3 to 5%, but in urban it's higher, like in our research in West Jakarta, in St. Junior High School, it's about 11.7%. But other in West, in Central Jakarta, it's higher, 15%. So we can say that Indonesia, roughly about 5% of people suffering from asthma.
So it says it's increasing annually.
Yep, that's right.
Why do you think? Is it because of, as you explained?
Yes, since the lifestyle, changing in the lifestyle, that take food, like, you know, there is ingredient, junk food, and it's also the other factors, the stress also, and then also air pollution, actually, and smoking also.
But is it hereditary?
Some of them, yes, but 35 to 50% are hereditary, but the others, no.
Okay, what time do they develop asthma if it's not hereditary?
Sometimes early as the years, like from, we can understand it's asthma or not after 2 years of life.
2 years?
Yes.
Okay.
Since child, we can notice that it is asthma or not. Yep.
All right. But then if you are already matured and you develop asthma at around maybe 15, 16, is that stress or?
It's so many factors.
Oh,
yeah, and that is very interesting indeed. If the asthma develop when they are child, then it's easy to be controlled.
Okay.
Can be, we can control. Yeah, not can be cured. Not it cannot. Asthma cannot be cured, but can be controlled. Yes.
Oh.
Because the base of asthma is chronic inflammation. Then even the patient no symptoms, but the chronic inflammation is still there.
Okay.
But if asthma develop at the elderly, it's hard to be controlled.
Oh, but if asthma was developed early in the age, it could be controlled easily. It could be controlled
easily, rather if it exists after 30 years old or older than that.
What can we do to prevent asthma?
Asthma, first, to avoid the pollution, actually. Like if there's somebody in the family smoke, you should ask them to stop smoke. Or at least not smoke at home.
All right.
Yeah.
But how can you avoid pollution, doctor,
pollution
in Jakarta?
Of course we cannot, but it's the government's, government's business about the pollution. But for the asthma patient, we ask them to avoid as possible. As possible.
Oh, okay.
Yeah.
And you are as one of the Indonesian Asthma Foundation member. Yeah. Is that finding solution? What is the solution to this situation?
Yes, first we give education for the public and also for the doctors how to manage the asthma, and then the others we also funds, and then we donate for the especially the poor, the people cannot afford the asthma drugs.
Medication.
Yeah, we have the asthma dispensary that we give the drugs is rather cheaper for them. Yep.
But
then also we create the asthma gymnastic for the asthma patient. We have, and we create the asthma gymnastic since 1986.
Yeah, I remember
and
that.
When we revised in 2003.
Oh, I see.
When the asthma patients follow this gymnastic, they can reduce the symptoms. Sometimes they can reduce also the drugs.
Oh, okay. But the thing is, for asthma, in Jakarta, it's very difficult to avoid.
Yeah, that's right. So that's why we ask them to use the drugs properly to control asthma. We have now the drug that can control the asthma.
Is it fatal? I mean, the disease itself, asthma? Can it cause
actually,
death?
not fatal, but it's very noisy. Can annoy.
Annoying.
Yeah, if like you're the executive, you're the announcer. If you're suffering from asthma, you cannot.
Hope not. Yeah.
That's
if
right.
I'm reading the news and I have asthma.
Yeah, that's very terrible.
Bad.
Yeah, that's why we ask the patient to use the drugs properly. You know, the term of the asthma words now is unmet asthma needs. It means not in Indonesia, all over the world. Usually the asthma patient, they cannot control the asthma properly because sometimes they don't use the proper drug or they don't get the optimal treatment for the asthma.
Okay.
Yep.
But the thing is, are there any deaths because of asthma here in Indonesia? Still occurring?
Yeah.
Still?
Still.
What about the percentage?
It's very few. Usually, when we come to the doctors, we cannot do anything
because they cannot breathe, right?
Yeah, that's right. Yeah. So once they get the attack, they should find the doctors as soon as possible. Oh, they should have drugs
at home, always ready.
Yep.
So if you have an attack,
Yeah.
then can you do something yourself without going to the doctors?
Yeah. First, you should go to the environment that can get the fresh air, and then also to lose your clothes and then breathe calmly, not be panicked.
But it's good for them to go to the beaches like that, no? Do you think?
Yeah, usually in the beach the air is very fresh, no air pollution. That's why. So
that the governments give optimal support in this area.
Yeah, we ask them to more asthma drugs are very expensive. Usually the inhaled drug, the inhalation.
Yeah, it's very expensive.
Very expensive indeed. And then we ask the government to help to reduce this price.
Was it successful?
We went to the Ministry of Health last week, and then she promised us to do that. Yeah. And then we ask the asthma patient to use the inhaled drug rather than oral or injection.
Oh.
Yes, because inhaled drugs has some advantage. First, it's very small dose, and then also the side effects are almost minimal. Sometimes there's no side effect. Yeah.
But it's more expensive.
Yeah, that's the problem.
Why.
Yeah.
What will the theme for this year's World Asthma Day? When is this, the World Asthma Day?
This year is in May 3rd.
May the 3rd. It already passed, yeah?
Yep.
What was the theme then?
The theme is unmet asthma needs.
Oh, you mentioned already.
Okay.
Unmet. So can you elaborate a little bit?
Yeah, unmet. It means the asthma can be controlled.
Oh.
But now all over the world, many patients asthma they have the not uncontrolled asthma.
What is about developing countries and developed countries? What are the percentage?
In developed countries, especially in Anglo-Saxon countries like UK, Canada, Australia, and New Zealand, the prevalence of asthma is highest in the world.
Really?
Yes, about 20 to 30%.
Oh, that's surprising. I thought they have fresher air there.
Yeah, but there is one theory. In one country, if the infection is low, the asthma prevalence high.
Oh.
That's why.
Is that true?
In developed country, the infection is decreased, but the asthma prevalence higher.
Yes, Now, what can be done then to prevent asthma in general?
Yeah.
Last question. So we will have a free world of asthma.
If in the family there is any symptoms like chronic cough, you should aware whether this asthma or not.
Okay.
And then if somebody suffering from asthma, they should get the proper drug, proper treatment, and then the asthma can be controlled. That's the key.
That's the most important thing.
The most important
asthma
thing.
can be controlled.
Can be controlled.
It could be fatal, but if you control,
yeah, you
then
can
it's okay.
you can live like as usual people.
Okay.
Yeah.
Dr. Faisal Yunus,
Yep.
thank you very much for coming to the
you are
studio.
welcome. Yeah.
Success in your organization.
Okay. You too.
Thank you.
Thank you.
And that was Faisal Yunus speaking on asthma disease. Don't go away, as well. We'll be back with foreign news after the break.